The recent measles outbreak in the U.S., claiming at least 3 lives, including 2 children, has cast a stark spotlight on the ongoing debate surrounding vaccination. The tragedy underscores the urgent need for clear, consistent messaging about the efficacy and safety of established preventative measures. However, the situation has been further complicated by the actions and pronouncements of prominent figures, adding layers of confusion and potentially hindering public health efforts. Robert F. Kennedy Jr.'s visit to Texas following the death of 8-year-old Daisy Hildebrand from measles exemplifies this complexity. His attendance at the funeral, ostensibly to offer condolences, was immediately followed by a tweet praising 2 unconventional practitioners, Richard Bartlett and Ben Edwards, who have openly eschewed the MMR vaccine. Kennedy's endorsement, devoid of scientific evidence, claims these individuals successfully treated some 300 measles-stricken Mennonite children. This assertion, presented without verifiable data or peer-reviewed studies, raises serious concerns about the dissemination of potentially misleading information. The Texas Medical Board's past disciplinary actions against Dr. Bartlett further complicate the narrative. In 2003, he faced sanctions for inappropriate treatment of patients with intravenous antibiotics and other medications, highlighting a pattern of unorthodox medical practices. His purported magic bullet treatment for COVID-19, reportedly containing budesonide and clarithromycin, the same drugs he allegedly used to treat measles, raises further red flags regarding his medical judgment and adherence to established protocols. His past also includes a criminal trespass warning for allegedly rummaging through trash at a hospital where he was not employed, indicating a concerning disregard for established medical and ethical norms. Dr. Edwards, operating from a converted barn, promotes a vaccine-free wellness practice centered on nutrition and supplements like cod liver oil and vitamins. His approach, while potentially beneficial as part of a comprehensive healthcare strategy, is presented as a standalone solution for a highly contagious and potentially lethal disease. This oversimplification of a complex medical issue runs the risk of undermining public trust in established medical expertise and preventative measures. The lack of robust scientific backing for these alternative treatments underscores the dangers of relying on unsubstantiated claims, especially in situations involving life-threatening illnesses. Kennedy's own messaging further contributes to the confusion. While acknowledging the efficacy of the MMR vaccine, his simultaneous praise for Bartlett and Edwards creates a jarring dichotomy. His actions appear to endorse a dangerous duality, subtly suggesting that alternative, unproven methods are equally viable, if not superior, to established medical practices. This mixed messaging, particularly from a figure with significant influence, risks undermining public health initiatives and potentially jeopardizing the health and safety of vulnerable populations. The deaths of Daisy Hildebrand and 6-year-old Kaylee Fair serve as stark reminders of the potentially devastating consequences of vaccine hesitancy. Both children were unvaccinated, highlighting the direct link between vaccine refusal and preventable mortality. Gaines County, where these tragedies occurred, boasts a significantly higher vaccine exemption rate, nearly 18%, compared to the national average, 3%, directly correlating with the higher incidence of measles cases. The U.S. Health and Human Services Department's confirmation of Hildebrand's death, citing measles complications as a contributing factor, reinforces the importance of vaccination. The easily preventable nature of the disease emphasizes the tragic and unnecessary loss of these young lives. The ongoing investigation into Hildebrand's death underscores the seriousness of the situation and the need for decisive action to address the underlying issues driving vaccine hesitancy. The lack of consistent messaging from leading figures exacerbates the problem, sowing confusion and potentially hindering the effective implementation of critical public health strategies. The combination of unsubstantiated claims, mixed messaging, and a high rate of vaccine exemption paints a grim picture, highlighting the crucial need for clear, evidence-based communication to protect public health. The focus should remain firmly on the proven efficacy and safety of vaccination as the most effective method of preventing measles outbreaks and safeguarding the health and well-being of communities.